Good afternoon. I am Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department, and welcome to the TriCounty update for Thursday, December 9th. For Peoria, Tazewell, and Woodford counties, our to-day total is 60,120 cases. That is an increase of 1,920 cases over the past week alone. That brings Peoria to 30,045 cases, an increase of 787 over the past week. Tazewell County now sits at 23,343, an increase of 925, and Woodford County now is at 6,732, an increase of 208 over the past week. We also sadly added 10 additional deaths to the Tri-County, bringing our to-date total to 880. That includes 425 Peoria County residents, 347 Tazewell County residents, and 108 Woodford County residents. Currently, we have 2,219 active cases at home and isolating. Our previous week, we were at 1,644, so 1,644. Last week, we only had 39 Tri-County residents hospitalized. Today, we are at 69. Our 7-day rolling average in Peoria County now is in the Tri-County, is at 274 new cases each day, and Peoria County is at 112 new cases each day. For the hospital systems, OSF St. Francis Medical Center, Unity Point Health Central Illinois, we currently are utilizing 27 ICU beds and 109 non-ICU beds. We're also saddened to report 2 deaths over the past 24 hours. That brings our capacity for the hospital systems at 27 ICU beds on average in use, compared to 19 in the past week, and 92 non-ICU beds in use, compared to 71 in the past week. Peoria, Tazewell, and Woodford County are all part of Region 2, which now sits at 33% of their ICU beds are in use for COVID patients alone. Again, to give perspective, that means in our Tri-County area as well as in a larger region, 1 out of 3 ICU beds are being utilized for COVID. We currently are also seeing the highest positivity rates in the past 7 months. The surge that is happening is creating an increased burden on our healthcare and our public health systems. And there's a lot of ways that we can address this. First and foremost, make sure you are getting tested. This time of year, we have a runny nose when we come maybe in and out of a heated car to a cold outdoor, or vice versa into your parking lot, to your building, what have you. But you need to get tested. There's multiple opportunities for testing, including the Civic Center, our healthcare systems, and even pharmacies. I will note the one specific thing, and I hope our media outlets can share this as well, is there are multiple over-the-counter tests, or OTCs, that you can buy at a Walgreens or at a CVS. These are really critical in helping to identify your symptoms. But it's also important to note that these tests do not get reported to your hospital systems. They do not get reported to your doctor's office. They don't get reported to your health department. So these tests are not part of what we call the public health surveillance system. What that means is if you are needing a letter to return to work, if you are needing to have documentation as why you are missing activities, the over-the-counter tests, while useful for quick detection, are not going to be ones that are accepted or that we know about to be able to follow through with. So specifically for school-aged children and families that are getting tested, please make sure you're getting tested using a laboratory system. So CVS Pharmacy, Walgreens, the OSF Ergos, the Prompt Cares, the medical groups, Unity Point Health Clinics, Heartland Health Services, our hospital systems, and of course the Civic Center, which has PCR testing. This is imperative. Again, we're getting inundated trying to get ahead of all the cases that are coming in, but also people asking and demanding letters for an over-the-counter test that we've never seen the results for. So again, if you know you're going to need a letter for some reason, make sure you're utilizing those laboratory associated testing sites. The other thing to recognize is that masking is still here. We need to continue masking. When we moved indoors, it was part of the weather, but we may have gotten a little bit complacent about our masking. Masking is effective. It is making sure that this holiday season that we do properly mask. And of course, getting vaccinated. Peoria County currently sits at 54.67% fully vaccinated. Tazewell County is at 53.69%, and Woodford County is at 50.8%. Vaccinations run the gamut. I can speak for Peoria Health Department. We are offering walk-ins Monday through Friday from 8:30 to 4. This includes all vaccines and all types of vaccine dosing. That means we're offering Pfizer, both pediatric and non-pediatric, Moderna and Johnson & Johnson for people getting their first dose or their second dose, as well as boosters across the board. And so again, there's no computer system you need to log into. There's no email chain or text message. You just need to show up at the health department, have your card if you've already been vaccinated, or you're trying to get your booster or your second dose, or just walk on in and we will get you taken care of. The most important thing is that we want to decrease any barriers as to why you're getting your vaccine. I will add that even people that are fully health aware have told me that they are postponing their booster because they need to make sure that they don't have anything scheduled the next day. I think a lot of people say like, oh, if I get it, I feel ill, I want to make sure it's maybe Saturday or Sunday. That shouldn't be an excuse. We're seeing the highest levels of cases right now. If you have the opportunity, get it done now. As someone who's received their booster, sure, I didn't feel the best in 24 hours, but I am so happy that it's just 24 hours versus ending up, like I said, as being one of those ICU cases. So again, take advantage when you have the idea to get it. Come to the health department, 8:30 to 4, no appointments needed, just walk in and get your vaccine. Today, they also announced that the FDA has authorized Pfizer boosters for 16 to 17-year-olds. Again, this is a critical step in getting ahead of not only our current Delta variant, which is our most common variant, but any subsequent variants that come through. So we are waiting for the ACIP recommendations to follow suit, but once that is cleared, if you're 16 to 17 and you're looking for your Pfizer booster, please also come to the health department or one of your providers. With that, I'll open it up to questions.
How much more susceptible are people who haven't gotten boosters compared to people who have? I mean, how imperative is it for people to get their boosters if they're eligible?
So the question is, how imperative is it for individuals to get their boosters? If we're talking about the hierarchy of vaccinations, if you've not gotten a single dose at all, you should be running as fast as possible to a location to get your vaccine. Subsequently, boosters are really important because we know that there is waning immunity. And what the early studies we're seeing of the variants coming out is that individuals that have had 3 doses or had their booster are still having a stronger protection than individuals with just 2 doses. So again, there's still early studies. We still are a few weeks out until we have the full documentation of what it means from vaccination, transmission, severity. But already the early data from just real life cases, we're seeing that that booster is very protective against these variants, especially for severity of illness and death. So again, getting that booster is imperative. And it's 6 months after for your Pfizer or Moderna, or 2 months after your Johnson & Johnson.
Is the area starting to see an increase in vaccinations now that infections are starting to go up?
So the question, are we seeing an increase in vaccinations now that we see kind of cases also go up? A little bit. I think what we're seeing is a mixed value. We're seeing, one, the 5 and 11-year-olds that were eligible to get their first Pfizer dose. Many of them got their second dose last week. And so we know like OSF, for example, had 2 very large Saturday clinics. Those second doses happened last Saturday, and another one will be this Saturday. So we're starting to see actually the 5 to 11-year-olds coming through and becoming fully vaccinated. I think we're also seeing a lot of boosters. I would say one of the numbers we are seeing just anecdotally at the health department is people recognizing that now, hey, it's at 6 months, there are variants, it's my time, come to the health department. So we're seeing a lot of boosters coming through as well. But really, I hope to see that fully vaccinated number keep growing past getting to the 60s here in our county. That would be great.
Are there any numbers on how many 5 to 11-year-olds have gotten their second doses? Or?
We do have those numbers, but not with me right now.
With hospitalizations, from what I can tell, are at their highest now since mid-May. And can you elaborate a little bit more on what our ICU bed status is, how many are being used, how many are still available, and how quickly they're disappearing?
So overall, our ICU capacity this time of year is always strained because we're in the middle of respiratory season, whether it's influenza or other respiratory illnesses. So, right now, our ICU beds, seeing that there's 27 in use, that is a considerable chunk of our ICU beds between the two hospital systems. I would say close to a quarter of the beds are in use just for COVID. That still means that there are people with heart attacks, people with other respiratory illnesses, whether it's pneumonia or severe influenza. Any of that is still also taking up capacity. Getting a vaccine is a way of alleviating that pressure on our healthcare system to make sure beds are available. And so as we move into this colder season and gatherings, make sure you've gotten your booster, make sure you've gotten your vaccine, and continue to mask and socially distance. And if you are sick, get tested and isolate away from other people.
And for those who are still confused about it, can you just explain what the vaccine is supposed to do? Because with the when the news came out about the Omicron variant coming to Illinois, and the person who was infected with it was fully vaccinated and had their booster shots, I've been seeing so many people, saying, well, they were fully vaccinated, how did they get it? So can you just explain the point of the vaccine?
Yeah, definitely. A great question is, what is a purpose for a vaccine? First and foremost, the purpose of vaccination is to prevent severe illness and death. And even though we did see a breakthrough case with the variant, that individual was able to stay at home, had a mild cough, and was not hospitalized at all. So, in essence, the vaccine worked. It's key to understand that that's the primary purpose of a vaccine, is to prevent severity and death. What we get used to is the secondary and tertiary, where it's how much does it stop transmission? Does it prevent me from getting it at all? And again, it depends on the type of virus you're working with, whether or not that vaccine is in that spectrum. But all vaccines across the board, their primary focus is to prevent severe illness and death. All of them do it. Sometimes we just need one vaccine when we're a child, such as polio, or we might need to have a booster of another vaccine as we get older. Think about tetanus, right? Or we have to have annual vaccines like influenza. But overall, their primary goal is to prevent death and severe illness. And so I know we get maybe too comfortable thinking that it's supposed to do everything for us. It is a magic bullet. No. What it's meant to do is create barriers of protection so that we don't, inundate our hospital systems, our public health infrastructure, or cause severe mortality or morbidity. And the vaccine continues to do that. What we want to make sure is that we need to get ahead of it, right? And so to keep getting ahead of it, we need to get as many people as vaccinated as possible so that, again, that shield gets stronger and continues to grow and be protective, so that if another variant comes in, or even the one that's running through right now, and we, even though we're fully vaccinated, we are exposed to it, our likelihood of becoming severely ill or transmitting it is still less than if we had no protection at all. I think we had a speaker who said it best, and actually when I was coming here, I listened to an article about it, seatbelt safety. Cars are safe. Cars are built to have a lot of safety measures. They have crumple zones. They have airbags. They even have, some have enough technology to actually sense cars in front of you. They also have seatbelts. An effective seatbelt use is important. Now, do people still pass away with car accidents? Yes. But the severities that we've seen over time, when you talk and you watch all of the things that we've done as an industry around car safety, that severity and death becomes less and less over time because of those. And again, that's what all of these mitigations are for, is to prevent severe illness and death.
And since the number of people who are getting sick is increasing, do you see some of those mitigations coming back, or what do you see as going forward from here?
So the question is, with seeing these surges, are we going to come back to different mitigation levels? I think we are very much understanding the fact that vaccinations are now much more readily available. And so it does become a strike a balance of at what point do we have mitigations, and at what point do we need to recognize that individuals take on the role of protecting themselves and their communities. And so right now, I think we're in a different scenario than we were last year. Even for vaccinations, I think people were calling us, asking us, did you get the vaccine in yet? And now we have so much availability. So it's a different landscape. I personally hope that we don't see severe mitigation levels again, but that's on us. That's us wearing our masks, getting tested if we're sick, and socially distancing and getting our vaccines.
Are you seeing any particular age groups triggering or increasing in this current surge that we're seeing?
So in the current surge, are we seeing any specific age group? We did see, I think, a large amount in our younger population, which is part of where we've seen most of our cases, which is unvaccinated individuals. Again, even those kids that got their second dose last week, they are not considered fully vaccinated until next week. So again, it's still our younger population, but that I don't know if it's actually their age versus the fact that it's more universally unvaccinated individuals. So we see high rates in our 20-year-olds or 30-year-olds, which have had access to the vaccine for months now, but it's unvaccinated individuals that are cases.
Are we still seeing Delta as the primary variant in the region, and has there been any Omicron sightings yet?
So which is our primary variant in our region is still Delta, and I'm actually glad you brought this question up because a lot of people want to get tested for Omicron or for Delta. First and foremost, you have to get tested for COVID, and then your actual test sample will actually be sequenced to know what variant it is. That's part of public health surveillance. If you test negative for COVID, that doesn't mean that you have the variant. You actually have to get tested for COVID, test positive, and then we sequence it out. Here locally, we have not seen the variant. Delta is still our primary, but again, it's not a matter of if, it's a matter of when.
I just wanted to ask about the 16, 17-year-old approval for boosters. If there is a 16 or 17-year-old that walks into a clinic tomorrow, say, the Peoria Public Health, do you guys have those boosters? Is it something that they might have to wait on a couple days till they get shipped in?
So in terms of the 16 to 17-year-old boosters, we actually have it's the same type of booster as for 18 and older. So we have the supply available. It's just making sure that we have the clear ACIP recommendations. So again, with all the vaccines, it goes through those different layers. The FDA approval is definitely the first step. And as long as ACIP makes that quick recommendation or changes its recommendations to include it, the 16 to 17-year-olds, as soon as that's finalized, we're ready to and able to do it at our health department as well as other healthcare providers.
Is there a timeline for when that might happen yet, or?
Because FDA just announced today the booster, I would say you're looking at early next week.
Thank you.
Mm-hmm.
So with the FDA approval, it was for 16, 17 for Pfizer boosters. Can teens in that age group who receive Moderna initial doses, can they get Pfizer boosters, or how does that work?
So that's a great question, whether or not if you've received your Moderna vaccination as your initial sequence, moving over to get a Pfizer booster, especially for the 16 to 17-year-olds. I've not gone through the entire FDA documentation, but that's clearly why we need some of that ACIP guidelines, just to make sure that the FDA, when they did that approval, they took into consideration the individuals that might have gotten Moderna or even Moderna as their first round of vaccine. So again, all of that will be hopefully clearly laid out with the ACIP recommendations that come through.
Last week, Sheriff Brian Asbell mentioned there was an outbreak at the jail. Is there any update on that?
So the Peoria City County Health Department continues to work with the Sheriff's Department regarding their ongoing outbreak in the jail. Again, the jail has not been immune to this. They've had outbreaks in the past, and they've worked in lockstep with the health department. I think there is another layer on this with a member of Team Peoria County passing away in this kind of timeline as well. And so again, our condolences to the family. We understand a lot of interest is around this. But the health department and the sheriff's department has been doing all the mitigation and working through this. And in fact, I believe that we've also looked to get some state assets in to help relieve some of the pressure that has been on the sheriff's department for testing.
With cases on the rise and now the holiday season coming over the next few weeks, Is social distancing still going to be important as people try to gather and have family gatherings?
So I think with the holiday season coming, what are those mitigations? What do we have to think first? I think similar to with Thanksgiving, but maybe much more needs to adhere a little bit more because we are seeing a surge from that group is first and foremost getting tested if you are feeling ill. Also, getting a PCR test is a good example of a way to be proactive. You may not have symptoms, so getting a PCR test to know if you're asymptomatic is also really important. If you know you're going to go visit high-risk individuals such as elderly grandparents or aunts and uncles. So first and foremost, if you're sick, stay home, get tested, and take care of yourself. Making sure you're fully vaccinated if you're eligible and you have your booster is going to be really important. And then masking. If you're able to distance, some places, you may be going to warmer weather where you can take things outside, that's great. But around your household, if you are mixing, one of the things to note is understanding what everyone's status is on that, as well as, working with masks as part of that. Well, thank you, everyone. I think we are going to do a press briefing next Thursday, and then hopefully we'll have some updates. But then any other schedule of press briefings, Diana will be willing to share with you guys. Thank you.